So hi guys, I'm Talah,
And
and
I'm Momo.
yeah,
And
today we're going to do pharma review questions. We got like a bunch of questions from the different lectures. If you have any questions regarding the questions or regarding a concept in the lecture, you can ask us, and that's pretty much it. So let's dive into the first question. Okay. So, does anyone want to read it, or shall I read it for you?
I think read it, it's fine.
So a 20-year-old male patient scheduled for hernia surgery was anesthetized with halothane and nitrous oxide. Okay, tibocurine was provided for skeletal muscle relaxation. The patient rapidly developed tachycardia and became hypertensive. Generalized skeletal muscle rigidity was accompanied by marked hyperthermia. Laboratory values revealed hyperkalemia and acidosis. The patient should be treated immediately with. So, what do you think the patient is going through? He was given halothane and nitrous oxide, and then he had like symptoms. Like the main symptom you guys have to look at is marked hyperthermia. So, what do you think the what happened? Okay,
Yeah. Okay.
that's pretty much what happened. Yeah. So, how do we treat malignant hyperthermia? Like, what is the antidote or something like that? Dantrolene.
Yeah.
Ah. So this is, guys, like a very important. It's like a high yield point because I remember Dr. Hatouf like really stressed on it a lot, and I think we got a question on it in the final. So, يعني, make sure you know the antidote that is used for malignant hyperthermia. Mom, guys, I need you to write the answers in the box chat to interact. ما بصير هيك.
Okay. I hope that was clear though.
Do you have any questions regarding this? I think it's like up to the point. Like you guys can skip everything. Like you
Yeah.
won't even care about the tachycardia, hypertensive. No. Just see marked hyperthermia. Just know that basically we have like very rapid increase in temperature, and he was given an anesthesia. So just know it's like malignant hyperthermia, and we give that treatment. All right. Next.
Okay. I can read
So
it
if
if you want.
ketamine, yeah, sure.
Go. If ketamine is used as the sole anesthetic in the attempted reduction of a dislocated shoulder joint, its actions will include which of the following?
This is like really easy, guys. Just write the letter.
Yeah.
Yeah, pretty
Okay.
much. So basically, the main idea is that ketamine is both an anesthetic and an analgesic. So it can be used for both, for like putting a person through like sedation and as well as for basically relieving of pain, right? I think this is easy. Do you have any questions? No, right?
Yeah, they usually bring ketamine in like questions, that's why. Okay.
Yeah, they love ketamine. I
I
don't know
know.
why. They actually love it. Okay. So post-operative vomiting is uncommon with this intravenous agent, and patients are often able to ambulate sooner than those who receive other anesthetics. Which of those do you think it is? Okay.
Oh.
That was fast.
Okay.
That is true because basically propofol has an antiemetic effect as well. That was
Yeah.
perfect. Okay. You want to read
It
this one?
is, yeah. A 6-year-old child was badly burned when his house caught on fire. He sustained full thickness burns on approximately 40% of his body, and he has spent many months enduring multiple skin grafting procedures. To aid in reducing the pain associated with dressing changes, he is given ketamine, again, IV. This drug has been associated with which of the following adverse reactions?
E. E. E.
B, E, E.
B. It's like the B. Like
Yeah.
Okay, so the right answer is, wait,
So
it's E.
E.
That is true because basically we know that ketamine is also a hallucinogen. So basically it induces hallucinations. Therefore, E would be like the right question. Now B, I don't think it's correct because sensitization of the heart to catecholamines, I think it has to do with like norepinephrine and epinephrine. I don't think it does that, you know.
Mm. Like E is
Can
one
you
of the main side effects of ketamine.
yeah, can you explain why did you choose B? Like it might make sense, yeah.
Okay,
You
all
don't
right.
hate
If it's clear, yeah.
I thought it causes heavy
Ah,
stimulation. Oh, I think it does,
let me.
but I changed my mind after you emailed
Okay.
me. Okay, perfect. Ah, next. So basically, a first-year surgery intern has rotated on numerous surgical services during the first year, including general surgery, cardiothoracic, urology, surgical oncology, trauma, and colorectal surgery. He has gotten quiet used to liberally ordering morphine for pain control. However, which of the following is an absolute contraindication to opioid use? Okay.
E. Okay.
Okay, we have A and we have E, but also A can work, no? Okay, so in this situation, let's check what the right question or the right answer
That
is.
answer.
I always say question, even with
It's
first year.
fine.
Okay, so
It's
it's
A.
A.
Yeah.
Right, says A. Okay, so basically, um, when you look at the different questions, like you can see here, guys, the answers. Which would be like more dangerous if it's like the bit like I know Dr. Santosh has both of them written and on the slide. But if you are in like if you're an intern and you're rotating, you'll definitely not give closed head injury opioids because this is like completely contraindicated, you know? But in biliary colic, it might be relatively contraindicated. You get me? So that's why we would stick to the closed head injury because it might exacerbate the injury, and this would be really, really lethal. Like, you get me? Are you guys convinced or no?
Okay. If you have questions,
Okay.
though, you can ask. Yeah.
Yeah, if you have any questions, ask. Just because of intern? No, it's not just because of intern. It's just that because يعني you have to check which contraindication is more severe. Like if a person has biliary colic or a closed head injury, which would cause more like damage, you get me? Like a closed head injury, if you give them opioid, it would cause like it might cost the patient his life, but in a biliary colic it won't cause this much of like like side effects. And you guys know the idea of like complete contraindication and relative
Yeah.
contraindication, where basically in complete contraindication, it's like a big no, like you never do that. But in a relative contraindication, you might be able to like depending on the case, you might be able to give them opioids. Okay.
I hope that was clear. Because even in his, yeah, okay. In his slide, he had them like separate too.
Yeah, he had them all
Yeah.
like
Yeah.
literally listed. Okay. خلاص, I'll move on to the next question. تمام?
Yeah.
Why can't I see anything? Wait. I can't see the chat. Wait. Okay.
No, they said it makes sense. Yeah, there's nothing.
تمام. Let me read this. So, a 51-year-old woman was seen in the emergency department because of strong abdominal pain. for the past hour. Physical examination showed a red-headed, pale-skinned woman in obvious distress with severe pain and tenderness of the right flank. A presumptive diagnosis of renal colic was made, and the patient was given an intramuscular injection of an opioid drug that is a partial agonist at mu receptor and a full agonist at kappa receptor. So which of the following drugs you think it is? Wait, where am I going?
Yeah, can you see the chat?
Yeah.
Okay.
Yeah. So that's pretty easy, guys. It's just important to know that pentazocine is like a partial agonist and what is it called? And a full like agonist at another receptor, because Dr. Santosh loves such questions. Like whenever, even like not only Dr. Santosh, all pharmacology doctors, they love questions where basically we have like a drug which acts like on two different receptors, and they have like, even I think, I don't know if you guys took in POD, but there was this drug that was an agonist at a receptor and an antagonist at another receptor.
Oh yeah.
So whenever you see such a drug, just know that it's gonna come, and the doctor is gonna ask because they love this. All right, and this is an easy question, Yani. Do you have any questions so far? Oh, clear. Okay. So which of the following patients should be prescribed methadone? The
Okay, yeah. Almost everyone.
Yeah, that's correct, B, because methadone is usually used to basically help people who abuse opioids. So like it's kind of like a drug that they give to the druggies, you know, to like what is it called? Like
Yeah.
become better, like in rehab. Okay.
Yeah.
Yeah, exactly. I guess it's clear. Can someone tell me what does methadone, like what's the mode of action of methadone? Long-term agonists. طب agonist لشو؟ For receptors. Okay. Just have a long life on new agonist with excessive protein binding. Yep. Okay, perfect. Okay. Do you want to read this, Momo?
Yeah, okay. A 30-year-old woman has suffered from cyclical migraines for many years. She now presents to her physician asking for a medication designated specifically for migraines, not just a general pain reliever. Her physician decided to prescribe sumatriptan as the trial medication. The patient, who is a biochemist, would like to know how this medication works. So how does it work?
You see, guys, in most of the exam questions, the question is super long, but
Yeah.
like the thing you need to know is very like you see, if you just see sumatriptan and medication works, you just know what the answer is. So guys, I like, especially in Euro, I really advise you guys to just start reading the question from the last sentence, just to know what are they like looking for, and then you can slowly skim through this and know the important thing. Because I'm telling you, in Euro, you're gonna have like long like questions, so this will help a lot. Anyways, back to the question. I think
Your correct
B is
answer. Yeah.
bravo, guys. You're doing amazing.
Yeah.
Next. Okay. So 46-year-old woman recently diagnosed with classic migraine had a headache attack at least once a week. Ergotamine was prescribed to prevent the impeding attacks. Which of the following actions most likely contributed to the therapeutic effect of the drug in the patient's disorder? So she is taking ergotamine, right? And she has migraine. A. Yep, it's basically A, because if you think of it, like if you look at the different things, the only thing that would actually relieve the pressure, all right, is the constriction of cerebral vessels, because usually when they're dilated, it causes a lot of pain, because you know how like in our brain the volume is like not volume, yeah, like the volume in like the in your skull is very limited. So basically, if the blood vessels all vasodilate, this is going to cause pain. So constriction of cerebral vessels would kind of relieve the pain.
Yeah.
Is this clear? Okay. Come on. Next.
A 43-year-old, or should I read? A
Yeah.
43-year-old man with a long history of exertional angina, which is a type of chest pain which causes reduced blood flow to the heart, was recently diagnosed with migraine. Which of the following anti-migraine drugs would be contraindicated in this patient?
Can someone explain why? Vasoconstrictor causes vasoconstriction and can cause coronaritis when right. They don't want to make it worse. Exactly. So basically, like sumatriptans, or basically triptan family, they're usually extremely contraindicated if we have a history of coronary vascular disease. And in here, we can see that the patient has exertional angina, which is part of like coronary vascular disease. Therefore, the first thing to remove is sumatriptan. That's basically it.
Yeah, just know
You
it's
guys have any?
because it's
Yeah.
one of the common drugs that are used.
Yeah, doctors love sumatriptan. I don't know why, but like migraine drugs, they love them. Is it clear?
Okay.
Thank you. Okay. Should I read this?
Yeah, go ahead.
Okay, so a 38-year-old man has an appointment with his otolaryngologist or whatever for the management of recurrence and sinusitis. A week after his appointment, the patient undergoes surgical debridement of the scarred sinus tissue, in which a local anesthetic with vasoconstrictive properties was used. Which of the following agents was most likely administered? The silence.
Uh, because when I put this question too, I was like, oh, D, okay. What else? B.
I have no idea. I love
Okay.
this answer.
Wait. Did you see?
BDE.
Okay. Someone said not A, B, I think. Okay, fine. Yeah, I'll just answer it.
Yes,
'Cause I'm
then
not.
you're not saying. Oh wait, do you want to share screen?
Me? No. Do you like mind or?
No, I'll just put the answer, okay?
Oh, okay.
Shall I?
Okay. Yeah, sure.
Let's relieve it.
So,
Reveal it, not relieve it.
yeah, so the correct answer. No, wait, why is it B? Wait,
Not?
sorry. It's not. Did you see the? Okay, I think
I think it was cocaine, right?
the answer is B. And I mean A, sorry.
Yeah, I think.
Wait. Yeah, I know. Like usually, so this is from the drug of abuse lecture, and I know cocaine is like it's a drug of abuse. You don't usually use it to like for medications and stuff. But out of all these choices, like one of the actions you should know about cocaine is that it can act as a local anesthetic, which means like you can apply it topically, such as in this case. Okay. Lidocaine is. I know you guys are more familiar with lidocaine being an anesthetic, but it's more like it's injected and it's harder to apply than topical, you know. And since this is like in the sinus tissue, which is in the sinus, like the nose area, so it's easier to do cocaine in a low dose than lidocaine. And the rest of the answers are wrong too. Are you guys okay? I'll change this to be A. I don't know why it moved, but
My luck is like that,
I
but yeah.
know. I'm sorry. Okay, wait, someone asked to repeat. So usually like cocaine is a drug of abuse. You don't use it normally again, but in terms of like if you want to use it for in some cases in low doses, for example, and in this question, since they said vasoconstrictive properties, cocaine, like one of the mechanism of action is the vasoconstriction, and it causes like it can be used topically instead of being injected, unlike lidocaine. So in this case, it's much easier to use with topical application. Yeah. They didn't say topical here, but you can kind of get an idea.
Yeah, because it's like debridement of scarred like tissue. So it's gonna probably be like something that you're gonna put on the scarred tissue itself, not on like you want to relieve the pain that is from the scar tissue. You get me?
Yeah. I thought like yeah. When I was like going through the lecture, I think the word that helped me most was vasoconstriction. So even the topical local anesthetic would help. But I hope that's clear for everyone. If you guys have any questions, do let me know. Yeah. Is that good with everyone? Okay. I was scared because no one. Okay, but I hope that's clear for the exam channel.
I don't think you're gonna get such a tricky question.
I don't think so, but
inshallah khair, you know, like I think if you guys understood it now, yeah, exactly. You'll know if you got something like that. Is this the CNS stimulants lecture?
Yeah.
Is it?
It's it's the same. It's
the hypnotics, no?
No.
Sedative hypnotics,
Yeah,
no?
drug of abuse.
Oh, okay, never mind.
Yeah. It's the same lecture.
Okay, so let's go to the next.
Let's move on to the next one. So a 45-year-old man who has been injured in a car accident is brought into the emergency room. His blood alcohol level on admission is 275. Hospital records show a prior hospitalization related seizures. I don't know what's wrong with this question, but his wife confirms that he has been drinking heavily for 3 weeks. What treatment should you provide to the patient if he goes into withdrawal? The main idea, like ignore the spelling mistakes, sorry. We have D, B, C.
B,
what is the rest? Yeah. D, okay.
Momo got you a tricky question.
I thought these were like. I'm
kidding, Momo.
Not D because it's kind of.
Because it's indicated, no?
Okay.
So it's not D. Hamas, we're gonna have like
trying to see if anyone. So it's not D.
It's B because CNS depression. But did they say that he had CNS depression?
No, the main thing here is seizures and from alcohol. How would you use it? Like, how would you try to treat that? I like how one of the options is none. I just saw it.
If I was in the exam, I would probably put none.
Yeah. Okay, wait. I can explain the answer because I saw someone answered it. Up. Can you go to the can you show the answer or? Okay, so the answer is, I hope it's in the right place. B.
It's B.
Yeah. So whoever said B, you guys are right. And this is the slide where it shows about like seizures. And you would treat it with one of so for Dr. Dana's slide, I recommend like focusing on everything she highlighted green. For seizures, for mainly treatment of seizures, you would use one of like these 3 drugs, and lorazepam is one of them, which was one of the options. It's related. No, I'm sorry. It's a spelling mistake. It's alcohol related seizure. Okay, wait. Let me see if
Wait, I'll go back. Let's see the
why
history.
do you
So
guys think
basically, he has blood. Because you know what, like lorazepam is for alcohol, and here we give it for alcohol or for seizures.
No, it's for seizures, but I saw that wait, go to
I
the
think
next.
it's because the seizure was triggered by the alcohol, so we need to work on the seizure itself because he has been admitted with the seizure. Like he wasn't admitted with a problem in his like alcohol. Like okay, he's been drinking heavily for 3 weeks, but that does not mean he's an alcoholic, and we need to treat him for the alcohol. You get me?
And yeah.
Usually, seizure is a symptom of alcohol withdrawal, and benzos like treat both.
It does treat both. So lorazepam is, I think, the most correct one. Yeah.
Yeah, it is.
I'm
It does says alcohol related.
I was fixing. Okay. Is that clear with everyone? Okay.
Shall we
If you
move
have
on?
questions again, let me know. Yeah.
Yeah,
Okay, you
it's
can.
okay. We can repeat it again.
Yeah. Okay, you can move on for now, I think. So.
Which one of the following statements is correct regarding the anxiolytic and hypnotic agents?
This is from that lecture.
Okay, wait. I will read them. So, do you think phenobarbital shows analgesic properties? We can answer it like this. Like, don't say the
Oh,
answer and say yes or no.
okay.
So, do you think
So
phenobarbital shows analgesic properties? If A is the answer, this would ruin the whole game.
I know. Okay, people said
Okay,
no.
no. Play it. Does diazepam and phenobarbital induce cytochrome P450 enzyme system? Okay, so A and B are gone. Phenobarbital is useful in the treatment of acute intermittent porphyria. I mean, this is not even, it's not heme. Yeah, it's not heme, so khalas.
Yeah, it's not.
Yeah, just cross it away. Phenobarbital induces respiratory depression, which is enhanced by the consumption of ethanol. I think that's the answer.
Yeah, okay. It is the answer, yeah. And the last one, bispirone, has actions similar to those of benzodiazepines. You know, they're completely different.
Okay. Can someone
But
tell us what is the action of bispirone?
yeah.
Allah.
And benzodiazepines.
Yo, who's gonna answer? Did we take bispirone? I think you did.
Yeah, I think.
I
Wait,
saw it. Yeah, I did.
act on GABA. Yeah, okay. Benzodiazepines is it does act on GABA, and that's why you have that effect on it. Well, I don't know. I saw it. Did you see it in a lecture? Or?
I think I did. I don't know, guys. I'm not sure, but I think I saw it somewhere.
Yeah.
Maybe it's not. I never saw.
Oh, never mind.
Okay, never mind.
Yeah,
If it's not there, then yeah.
Yeah, if it's not there, then yeah, then it wouldn't even be.
Yeah. Never mind.
Good. Someone mentioned like alcohol withdrawal with bispirone. That's why I thought you guys took it. But yeah, the answer is D. Can you go to the next slide?
Yeah.
So one of the you should know precautions for benzodiazepines, and one of them is for like people who have CNS who are using other CNS depressants with like alcohol. So you can't use it with alcohol basically. Another thing was with liver diseases. Be careful when you're treating people with that, and keep that in mind. Okay. So like if you're taking alcohol with one of these CNS depressants, it would make the situation so much more worse because it's a sedative. It has a hypnotic effect. Okay. I hope that's clear. Okay.
Here. Okay. Next question.
A 51-year-old woman with symptoms of major depression also has angle closure glaucoma. Which of the following antidepressants should be avoided in this patient?
D.
So D.
D.
Wait, what about the... Okay.
Is this A or is this a scream?
Huh? I don't know. I think
I think A.
yeah, okay.
A
Yeah,
is
A
TCA.
is yeah. It's this tricycle.
So A or not A?
I guess you want, yeah. So the A, I think, yeah, and the answer is A. I want to know why you guys choose D, but basically for like if you have, okay, so these are antidepressants. Even D is an antidepressant drug, but for people who have angle closure glaucoma, you should be careful because if there's any increase in the intraocular pressure, which can happen if there's any antimuscarinic. So that means that if there's any like constriction in like the drainage of the fluid in the eye, it can wait, I'll answer. Yeah, it can cause increase in intraocular pressure. Now we know that TCAs, the tricyclic antidepressants, they have an muscarinic effect, so they can cause things like dryness of the mouth and vasoconstriction. So that's why you should be careful in using like TCAs in these situations. Is that clear for everyone? Because basically, like, you don't want to increase the pressure because she has another problem in her eye as well. Okay.
Because, you know, guys, an increase in intraocular pressure might cost the person their vision. So this is really important. Like we have to.
Wait, I can explain the part about anti-muscarinics again. Wait, I think there I put a slide too. Oh, I didn't. But there's a whole
Wait, did you?
list of symptoms. Yeah.
No, you did not.
No, I didn't. But there's a whole list of symptoms after TCA, and it's like side effects or adverse effects of TCA. And one of them was this. Like it has a lot of effects. And it can cause other symptoms, but I just wanted to ask this question in this way. So if you guys know. Okay, so what type of antidepressant is D? Wait, for those of you like who answered D, can I know? Yeah, can I know why you guys did that? D is for tetracycline. Yeah, it is. But I when I was doing this, I thought mirtazapine was more of an atypical TCA. So like amitriptyline is the one that's more commonly used. So I would put A in this case. Is that okay with everyone? Okay.
Okay.
Yeah, but you are right. Like it is a TCA. It's used for major depressive disorder. But in this case, A is again more common. Okay. I
So
hope
a
that was
20-year-old female presents to the emergency room with headache, stiff neck, and fever for 2 days and is diagnosed with meningitis. Which of the following agents is the best choice for the treatment of meningitis in this patient? Cefazoline, cefdinier, cefepime, cefuroxime.
okay.
I can see that all of them are like
Yeah.
cephalosporins, right?
Yeah, that's why I put them. But in his slide, like Dr. Dilip had like only some of them mentioned. A.
Okay, let's see. Everyone's like,
Okay.
eh.
No, wait. This the answer is wrong. Why did the boxes move? But basically, the answer for this is C. I'm sorry. Okay.
So guys, why did you choose A?
Why did you choose A? That's my question. Because I know all of them are cephalosporins. C or A? It's C. C.
It's C. Because of the age? What does the age have to do with this?
Because okay, wait. I'll wait.
3 months to 5-year-old, 3 generation, and vancomycin.
I saw that, yeah, in the side. But the main thing, okay, so you're right about the age. Like, don't forget whatever he taught you about the ages, and like whatever you suspect in like which bacteria affected the patient. Okay, but okay, but the answer is C, which is cefepime, because the most important thing in meningitis is you have to consider whether they cross the blood-brain barrier and whether they can treat it. In this case, it's cefepime because of that, because it has adequate CSF penetration. Okay, I should have put his slide, but he had it like, he had it one of the, like, one of like the better options for treatment for meningitis. I hope that's clear for everyone again. Like, I hope I didn't confuse anyone. Okay.
So it's not D, okay, guys? It's C.
It's not D, yeah, it's C. My bad. No.
A 31-year-old university graduate could not find a suitable job after repeated interviews. In some desperate moment, he embarked on a drug of abuse. Soon after taking the drug, he experienced extreme anxiety, dysphoria, and became terrorized. The situation became so intolerable that he attempted suicide. Which one of the following drugs may he have taken? So you can clearly see that it caused paranoia.
And these are all like, yeah, drugs of abuse, B, D, B.
But why B, why D?
Why, yeah, why
Yeah.
B or D?
Bad trip, I don't
Oh, yeah,
know.
it was mentioned. This is not.
I think now I bad trip and you get with the other.
That was not the main like focus of that question. But oh, I get how you can get like, yeah. I know how like someone can get confused with that sentence.
I'm embarrassed to say I don't know what a bad trip is.
No, okay, wait. So I read it in their lecture. It was like, it was a point in his slide, and it was under, let's see, symptoms.
Did we
Okay,
take this?
we didn't. I think it was new. Okay, wait.
You feel like you got stuck.
I feel so bad.
But
You want to
did he like get stuck? I feel like it's more of like paranoia.
It's more, yeah.
Like,
It's not. It's like LSDs would have more signs of like hallucination or not. Yeah, it's not exactly this, because this here is more of it is extreme anxiety and terror. And I know like it could overlap and everything. Yeah, but in this case, I don't think it is hallucination.
so
That's my.
guys, do you have like the exact what is it called? The exact symptoms you get during bad trip?
Aiden.
We saw a
Oh,
video.
nice.
Mhm. Okay, so now back to the answer. What's the answer?
You want to show the answer? Or,
Okay.
also, it's fine to get them wrong here. It's completely fine. The answer
It's
is,
none of the answer.
it's fine. It's okay. I'm just like, I'm just worried. Like I confused you with the sentence, but the main thing here is methamphetamine, which is again another. It's the same name as amphetamine, and it's another drug of abuse. And main thing you should consider, like you should know that this is from the side effects, which is terror, anxiety, and he had a whole slide on this, like after it. LSDs would be more of, like, that's the thing, I couldn't find any questions on LSDs. LSDs would be more of hallucinations. He would see like things that are not there instead of being scared. Do you get what I mean? Because in this
Yeah,
case,
like he's not gonna be terrorized, but rather he's gonna like
plus
see things and hear voices and stuff. Plus, in
and
here, guys, he's a university graduate, and he's like the history kind of like points at amphetamines, because usually amphetamines are abused by people who wanna like concentrate on their exams. They wanna, or like like they wanna go into the focus. Yeah, used for ADHD. True. But
yeah,
basically, most of the time, like people who abuse amphetamines are either scholars or like uh, graduates or like college students. It's sad, but it's true.
yeah. And there was an example of that, I think. Okay, I hope that's clear for everyone.
We can
Okay.
look more into the bad trip,
Yeah.
like see what exactly the symptoms are, and we can guys send it to you on the batch group, like after the session. So
Also,
like
I was going to comment on the suicidal thoughts because I thought it was a strong indication of methamphetamine. Okay. Do you guys have any questions? The
and
first
first
aid.
aid,
Thought
amphetamines cause
before-
euphoria though.
Mm, okay, I don't know if it was in the lecture, but again, even if it causes euphoria, be like, make sure you know terror and anxiety comes with this drug. Okay, that's the whole point I want you guys to get out of this.
Shall I move on?
Yeah. Also, I wanted to comment on the last question. So I was like searching, cefazoline is a first generation cephalosporin, so it doesn't cross the blood-brain barrier. That's why it wasn't A. So
Yeah.
whoever said, because it's not third generation, I just remember. Okay, that's it.
Okay. I'll move on.
So trazodone is an antidepressant medication. What is its mechanism of action? Oh, I feel like
This is easy though.
I remember I put this. The only reason I put this was because it came in our exam, and I was like confused. Okay, see.
I think it is C.
Okay, yeah,
Everyone's C.
it is C. Yay!
Guys, you know what? In the antidepressant question, I still remember we got a very weird question in our exam. It was so annoying. Do you remember the question, Momo? It was like they gave us a drug, I think, and then they were like, you know how like antidepressants, they block مثلا serotonin and they block
Yeah.
other like مثلا dopamine and stuff like that. She gave us like a question, and then she's like, this drug, does it like block? Then she's like, completely serotonin
Oh
and
yeah, I
partially
remember.
dopamine and partially I don't know what. And then she gave like the whole, like literally like مثلا partially complete, partially complete. The question was very specific and it was very annoying. But in Dr. Samah's questions, like
That's why. Yeah.
they concentrate on the mode of action and on what receptors they usually like مثلا Dr. Hatouf loves side effects. Dr. Dana loves the things that are in green. Dr. Samah loves mode of action. Like she's like
And
most of
Doctor.
her questions are more of like pharma. Like they're not clinical. You get me?
So wait, there's a slide after this on the table of atypical antidepressants, and the ones in red are like important because I remember we got a question on trazodone, and she asked us this, and then there was another one on the incomplete complete. Was it this one? No,
I
right?
don't know.
I
You
don't know,
know,
but I
guys,
think
I
she
have
played with
a
the words. Yeah.
plus if she gives you like a table, and then yeah, it has like two extra drugs that she didn't go over in the lecture, study those drugs because this is what is gonna come.
Yeah. Because I remember she went through this like slide very quickly, but then it came. So I'm just saying.
Yeah, so you see how it's like, wait, yeah, you see how
Yeah.
it's like it blocks H1 as well, weak 5H, F5H like serotonin and stuff. She literally got such a question, you know? For guys, like I know it's very minor details, but try to like she specifies just 2 drugs from here. Do we trust her? I don't know, guys.
I would study like at least the ones in red, like the mechanism of action, not
Yeah,
side
guys, follow what Raid said. I feel like, yeah. Because I'm telling you, like, I don't know. But for the table, she didn't tell us no. Like, she didn't mention anything. But I know for me, I just went over it and I'm like, she never mentioned them in the class. Why would she get them? And then she did.
Yeah, that's all. Okay. But good, you guys got this one though. So shall I end the example?
Yeah.
Mhm.
So a 69-year-old man presents to the ER with respiratory depression. He was prescribed diazepam to treat his crippling anxiety. Which of the following drugs should be administered? I'm sorry, guys, I was laughing because it doesn't have with respiratory depression
Where?
in the beginning.
Oh, you guys
It's
got
fine,
that.
it's Ramadan.
Yeah. D.
Did he overdose? I don't know.
It just, yeah.
No, I don't think he did because it's just there
Yeah.
to treat his crippling anxiety.
But
I don't
then
think
it
so basically he has a drug, he took a drug which is diazepam to treat his anxiety. But then because he took this drug, he had respiratory depression. So what do you think? Which of the following drugs should be administered to like
someone said you
stop
don't,
the
yeah,
respiratory
you
depression?
get the question? No? Okay. D, C. I think we can show the answer because yeah, so it's D. So and
But
someone
why did you choose D?
oh.
Can someone I'm sorry.
It's okay, it's okay.
Can someone explain why? Adi guys, open the mic. Like speak with us.
I can explain.
Yeah.
Yalla.
I figured that because he's on diazepam, if he would overdose, then that would put him in respiratory depression. And so the antidote would be flumethasone for benzodiazepine.
Yeah.
I guess that's pretty much it, right?
Yeah, that's the main idea I want. Overdose and then yeah. Okay. And Dr. Dilip would get like things that are I don't know.
Very clear,
He
I
gets
think.
yeah.
He gets clear questions. Like he's just gonna be like if it's an overdose, he'll be like overdose, you know?
Yeah.
I hope so, yeah. I'm scared now. I said that and then the
No,
exam
no.
would be like
Yeah. And whoever said C, naloxone is more for alcohol use, I think. Not or opioids overdose. Yeah. It wasn't for benzodiazepines.
True.
Yeah, addicts, yeah.
For
Okay.
druggies.
Just know the difference between it.
Okay. So which of the following drugs is most useful for the treatment of absence seizures? D.
D. So like I know there is a lot of drugs for absence seizures, and there was a whole table on like the drugs. There's one major drug that there's a question coming up on that for absence seizures. Yeah. Okay, right. You see it. But anyways, yeah. So there's like if ethoxyzumide was not one of the options, what would be the second choice from here? Okay, valproic acid is correct too, but it's like yeah, D. 2 people said D. Okay, I have a slide on coming up too. So
Okay, shall I put the answer?
yeah, So it is D. This is like memorization, and this slide was from our slide, but Dr. Sama has the same exact thing. She has a slide for lamotrigine, and it's one of the newer like drugs that came, but it's also used for absence seizures. In Dr. Sama, it's like slides, it was highlighted in red, so I thought it was important to add. And it's after, if you see ethoxyxamide, that's the first, and then if you see, for example, lamotrigine, valproic acid, if they try to give one of those options, yeah, you should go for these, okay, for absence seizures. It can also be used for other seizures too, but since absence seizures has a like its own, it's a unique type of like seizure, so just know that, and it's in every exam, so
So I have a question, guys.
yeah.
What's the very characteristic thing about absence seizures?
Not pharma, but
Yeah, it's not.
okay, yeah, that's true.
Oh my God, that is true. Actually,
Yeah.
guys, I remember this from last year. Like, I didn't even like go over this lecture, but yeah,
Short-term
the
children,
spice
yeah.
and the children is very, because it's
That's
always in the question that
always
the child zoned out and then came back and the teacher saw that he zoned out. Exactly. Blinking, blank stares, so no post. Yeah, exactly.
okay. I hope that's clear.
Amazing, guys. Yeah, you're doing great. So,
Okay.
which statement concerning the proposed mechanism of action of anticonvulsant drugs is inaccurate? All of Momo's questions came like after each other.
Oh my, yeah, I know. That's why I was thinking. But these are from most of them. I got them from practice questions. B.
Yeah, we kind of ruined that before. We said that.
No. This is like it says inaccurate. But again, just know that ethoxyxamide is the first line of drug for absence seizures. Okay. Yeah, you're
And
right.
it's a drug that doctors love.
I know.
Even
So,
USMLE, they love it.
yeah, that's why. So, do you guys like? Can someone tell me the actual mechanism of action? It's not blocking. It doesn't block potassium. That's for sure.
For
Yeah.
T-type. Exactly.
Yay! I'm so happy.
Yeah, this is a very important one. The
This is
T-type
an
calcium channel is very important.
okay.
Okay. Yay.
Should
I
I read
have
it?
my questions. Yeah, sure.
Okay. A 78-year-old man has been showing increasing memory impairment and recognition deficits over the past 2 years. Recently, he became disoriented and confused at night. Physical examination revealed an alert person oriented to place with no focal neurological deficits. His physician prescribed a drug that might help to slow down the progression of his symptoms. Which of the following drugs would be appropriate for this patient? Again, it's a long question, but
Awalan, what do you think the patient has?
yeah.
Alzheimer's.
Yeah.
Like,
Okay.
okay, if he has Alzheimer, why did you choose C? Yeah, better. Actually, C is the right question, the right answer. Yeah. And it's pretty much what Firas said. It is an acetylcholine inhibitor. So, because it's the only drug for AT in the trial.
True. That's true. Because
Yeah, it
whenever
should not
I
make it
see,
that easy.
I like, yeah, I see the ending of the name and like I try to put.
What's the difference between C and D? Haloperidol, I don't think it's
No, it's
like,
not for
not for
uh
Alzheimer's.
it's
I
not for
think it
diseases. Because I remember we took it this year too, haloperidol. It was for
yeah, it's an antipsychotic. Exactly.
yeah,
It's not. It's for mood changes and stuff. Yeah,
schizo.
for schizophrenia.
Yeah.
Okay. So like haloperidol will act on dopamine. You get me? But rivastigmine is gonna act on what is it called? Acetylcholine. C and E, I meant. Sorry. Oh, physostomine, I think it's a very short acting. That's why they don't usually give it. That's
Yeah.
what I remember from last year's Sanaf.
That's what I remember too. Like we never, if there was another one,
Yeah.
we put it over.
Because physostomine is very short acting, it's not gonna help like elevate his system, his symptoms.
Is that clear for you?
Okay. And usually ribostomine is like the first line, I think, of treatment. Okay, so a 51-year-old woman complained of resting tremor in her left hand, difficulty in writing, and distressing sensation of inner restlessness. After careful neurologic examination, a diagnosis was made and an appropriate therapy was ordered that included a drug acting as a partial agonist at dopamine D2 receptor in the brain. Which of the following drugs was most likely prescribed? A. Why do you think A?
Like what's the diagnosis? They didn't say, right? Yeah.
Yeah, they didn't say the. We have a D. Anything ends
Yeah.
with O, but it's axon dopamine because the axon dopamine receptor. It's
Parkinson's.
Parkinson's.
It is Parkinson's.
Anything ends with O, it's dopamine. Okay, so the correct question, the correct answer is A. Because you guys are right, levodopa acts on dopamine, but in the question they say partial agonist, and this is very important because levodopa is not a partial agonist; it's a full agonist. But it's clearly in the slides. Even I remember that doctor had like different like arrows into different boxes, and one of them was pramipexole, and it was like clearly mentioned, and it's a partial agonist, and I'm pretty sure that this is very important, and like doctors love to ask about that. So levodopa is correct, like it does treat Parkinson, but in this question they like specifically asked for a partial agonist.
Yeah.
Like those are like mini tricks that might come in the exam,
Yeah.
Be careful about this. Come on.
Yeah.
Let's move on. So, you want to read it more?
A 52-year-old woman with a long history of Parkinson's disease has been receiving levodopa-carbidopa. Which of the following adverse effects of levodopa were most likely reduced by adding carbidopa to the treatment? See here, they used levodopa. B, D, B.
The whoever chose B, Y, and whoever chose D, Y. You can guys tell us through the mic. Like unmute yourself. Katsi الصراحة.
Oh, yeah.
Wait, Firas, you put B or D?
I can't. I mean,
Yeah, B.
probably.
So D, why did you guys choose D? Combination therapy decreases GIT. No. Honestly, I'm not sure anymore of my answer.
It's okay.
Combination therapy decreases. Why is the scroller not wait?
Decreases GIT and CVS symptoms, but not behavioral changes. It increases them.
Oh,
Yeah. And it's also good you watch Sketchy for like to remember these two.
true.
Yeah.
Okay, so the right answer is B, and the explanation that Rait said is like spot on. Basically, levodopa causes a lot of side effects, like especially like CVS, GIT, and then in the slides themselves, you guys can see that the doctor like kind of bolded the cardiac arrhythmias and the effect on CVS, and it's really lethal. So that's why carbidopa came to the rescue. And I'm not sure about whether it increases behavioral changes or not. But wait, I think oh no.
You want me to
I wrote like something, but it's not there. Anyways, so cardiac arrhythmias is the better answer, and for dyskinesias, it does not make it usually better. That's why. Is it clear? Okay.
I hope that's clear. Whoever
What drug will decrease dyskinesia?
For Parkinson, wait.
I am not sure,
Remember,
honestly.
yeah.
But we can look into it. I can
Yeah.
tell you after the session or at the end of the session. Okay. So which of the following is a non-competitive NMDA receptor inhibitor that can be used to treat Alzheimer's disease?
Mhm.
This is a very easy one. But come on, we got this, like this question is a repeated question in all previous questions. So I think it's important. And I think it's the only NMDA receptor inhibitor that we took.
Did we took?
Yeah.
Okay, that's good.
Okay, now to the essay question. I got you SAQ.
The only one.
Okay, so, oh my God, no! Do you see it?
No, it's fine. Read it.
Okay. So a 63-year-old woman with Parkinson's disease have been maintained on levodopa carbidopa with adjunctive use of a drug that acts by reducing central dopamine metabolism. Okay. After the use of the drug for a couple of weeks, the patient mentioned that she was suffering from inability to sleep. So what is the drug that was prescribed, and describe the mechanism at which the insomnia developed? So what do you think the adjunctive drug was? I kind of showed you the answer, guys. I hope you did not see it.
It didn't show that much. It's fine.
It did not? Oh, good.
Yeah, it was quick, so it's fine.
Panadol. Thank you, Yazan. Insomnia equals Selageline. That is true. Okay.
Yeah, that's
okay. So can you explain what is the mechanism at which the insomnia developed? Type B inhibitors. Okay. So why do we have insomnia? The silence.
it's fine.
They're either typing or they're bored.
Yeah, that's what I was thinking.
Because when patients takes it, they can't sleep well. Yeah. But why can't they sleep well? There's a specific, I don't know, maybe because it's irreversible. Because it inhibits the breakdown of dopamine, no metabolism of norepinephrine. I have no idea. So actually, Abdurrahman is correct. It has to do with norepinephrine. So because it is what is it called? It's a type B inhibitor. Oh my God. Okay. So
yeah.
Because I don't know what did Yazan write.
Is this from Google? I knew it.
It's rapidly metabolized and okay, guys, no, don't listen to Yazan. So Selageline is a type B inhibitor, all right? So it's not a selective inhibitor, so it might as well inhibit the metabolism of norepinephrine. So when the metabolism of norepinephrine is inhibited, this will cause more sympathetic stimulation. So you're going to be more energetic and you're not going to be able to sleep. All right. So this is the idea behind it. And I think is Dr. Santosh the one who gave this? I'm not sure, but whoever gave this, there was a slide that literally explained this, so I think it's important to know.
Yeah. Is that clear for everyone? Dr. Sama. I
kind of guessed that, but yalla.
Okay. Oh, Dr.
no,
Manan. I love
yeah,
her.
that is
Okay.
true. No, wait, no. Didn't
What?
Dr. Manal give you degenerative diseases? Drugs for
I.
this is
This
degenerative.
is
Yeah, yeah, it is. Yeah.
It's
Sorry,
fine.
guys.
Okay, it's fine. She didn't
Okay,
explain
yalla, next.
anything.
She did not? I found
long
it
as
on
you
the
guys-
slide though.
Yeah, as long as you guys get it from here, that's fine.
Yeah. It's just that it's because the norepinephrine is not being metabolized. So basically, you're just gonna be active all the time, and you're not gonna be able to sleep. So you're gonna have insomnia. She did not. I don't know, Sarah. And I opened the slides, and I like checked the whatever like stood out the most. And psilocybin is a drug that keeps on repeating in like the questions. So I thought it's important. Plus, you guys know that it causes insomnia. Like it's a very, very, very distinctive side effect.
Yeah.
So it's not, يعني خلاص, it's not. There's no harm in knowing that it does not, that it doesn't inhibit it does inhibit the metabolism of norepinephrine. So it causes you to be more active. Tom, so next, do you have any questions before I go next? Okay.
Okay, wait. For the question before this, for a drug that decreases dyskinesia, I searched it up. But did you guys take amantadine? I think you did.
Oh, they did.
Yeah,
They did.
this is the one that's okay. So this is the one that decreases dyskinesia. There's other drugs that like you didn't take, so it's fine not to know them, Also there are like but it's okay. That's more like you don't give things that would worsen dyskinesia basically, because there are drugs that can. Okay. That's it.
Yeah. Okay. Next. Okay.
Read it, it's fine. I'll read the
Okay.
next.
So a 74-year-old man who had been suffering from Parkinson's disease for 4 years complained of a purplish red mottling of the skin. I don't think I need to read it. Yeah, guys, خلاص, libido reticularis.
They got it.
Plus, guys, I'm proud of you. You know,
Yeah.
خلاص, no need to even read.
Yeah, from the first few sentences.
Libido a side effect. Exactly,
Yeah.
libido reticularis. خلاص, okay. I'll move on.
Oh yeah, this is the drug, amantadine. A 38-year-old woman comes to the physician because of a 3-week history of fatigue, difficulty sleeping, and feeling sad. She has been unable to concentrate recently and is no longer interested in spending time with her friends. Mental status examination shows a depressed mood and flat affect. Treatment with a drug is begun that treats her depressed mood. After having Marmite for breakfast, she started experiencing episodes of severe high blood pressure. Which drug was she? Someone said E already. E. Okay. Okay, so
Whoever said E, why E?
yeah, I was about to start. Okay, side effect. So basically, yeah, this focuses on drug-drug interaction. So which one is most likely? Yeah, what about the rest?
E.
E.
Yeah, it is E.
Yeah, we just wanted to know. You guys knew. Yeah.
Tyramine thing. Exactly, this reaction. I changed they said like cheese. I changed it to Marmite. I was hoping you guys don't know what Marmite is, but
Yeah, I was more. That's not.
because it says on the slide cheese and Marmite.
Yeah, cheese and.
Like cheese is gonna be obvious. Let's put Marmite.
We don't know what that is. Yeah.
I don't know either, but like. Okay.
But since it was. Yeah, but you guys know that it does affect like with cheese, and someone said it too, so that's correct.
Yeah, it causes like anticholinergic. It's like a anticholinergic crisis, right?
Yeah.
Yeah, it does, and then it causes like increased blood pressure, and then anything that. Yeah, that's it. Tamam?
Ooh, we're almost done. Okay,
Okay.
all clear. Good.
An adolescent male is newly diagnosed with schizophrenia. Which of the following antipsychotic agents might have the best chance to improve his apathy and blunted effect? We answered that before.
I think. Yeah. Wait. Has everyone wait?
No,
Okay,
I
let me
don't
start
think it's
reading.
the correct answer. Wait. Hala عليك.
It is. I thought you were kidding. Yeah.
It was?
Oh no.
Then she's just copying me. أكيد I'm not copying her.
Yeah. I didn't know.
I didn't even say it صراحة.
Yeah.
I got it from practice questions.
Okay, but you guys get that. Like, do you guys understand why?
I feel like they do
Also,
because
it's
everyone said D so fast. I'm like,
yeah, that's
I had
oh
no
no.
idea. Billy, guys, you said D, explain it. مو بس هيك حافظين just cause it's second generation.
Also on the list, I think it's the most okay, so I didn't remember it.
That's great.
Yeah.
Okay, خلاص, we'll move on.
Yeah,
feel
but you guys are right. It is that. Okay, a manic patient has been brought to the hospital with non-stop talking, singing, uncontrollable behavior, and apparent loss of contact with reality. Which of the following is the most appropriate drug for rapid control of his symptoms? A.
Interesting.
It's do you guys have like does anyone have other answers? Would stabilize. Oh yeah. It is lithium is for
But it's not the right answer.
it's not the right answer here though. That's why I'm confused.
Yeah, I think it's not
But
because it's just because of rapid control. It's haloperidol,
Yeah.
and it's because because of rapid control. So you need something that is like fast acting. You get me? So you give them haloperidol.
And they're
Yeah,
like more we have been
don't panic. Maybe
like
like it's
haloperidol
fine.
is
It's just
yeah,
it's just
fine.
because rapid control. Both of them are mood stabilizers, and it's true.
Yeah.
Lithium is a mood stabilizer, but because because we need it for rapid control of his symptoms. We want something that is very fast acting, so we give haloperidol.
Yeah. And in this case, they're having like an acute event, manic event. So in this case, you would again for faster like control, you would use haloperidol. But whoever said lithium is a mood stabilizer, you're correct, and it is
Got it.
used for bipolar. Okay.
Is it
Do you
okay?
guys get yeah?
It's not bipolar, but it's just I don't know, but it just has an episode of mania, so it's probably
Yeah.
gonna be bipolar.
It can happen with or without bipolar. Would have never thought of it like that. Oh.
That's why we're here.
The more you know.
I thought schizophrenia symptoms cause loss of contact with reality.
Oh.
Honestly, I don't know what the diagnosis is. It's just the important thing
I
is the
thought it was mania because schizophrenia you need like you don't only have like loss of contact with reality. If I remember, you have to have positive, negative, and something symptoms. It's like hallucinations. You have delusions, all of that. Manic feels like bipolar. Yeah. Oh, go out, go full screen.
They can't. Can they see them?
Yeah.
Guys, close your eyes. Bye.
Okay, close your. Okay, as long as you guys get this part. Okay.
What did I do? The chat is gone.
No.
Oh, okay. It's
Oh,
okay.
I can.
Nice.
Yeah. Okay. Go ahead.
So the
Thanks.
psychotic symptom most benefited by neuroleptic drugs are
Someone said C.
I like questions easier than Momo's.
No, I don't. Yes. No.
Guys.
But they both.
That's muhim, yeah, that's true.
Well, okay.
I feel like
But they
I
like the
let you
easy
guys go
one.
easy.
No. Yeah. The thing is, like, I just wanted you guys to think more, but like, I hope they don't get something like complicated. It's a good mix. Okay. Yeah.
Fine. Like why what is it called? Why is it C? Positive, exactly.
Yeah.
No, wait.
Oh no, hallucination
We want to treat the positive symptoms? What do you mean by positive?
I think she means schizo.
Is the answer positive or are we positive? Like me and Momo?
No.
I meant no.
Oh, yeah.
They treat positive symptoms first, like
Yeah, sure.
usually.
Yeah. Usually they do not treat the negative symptoms, but rather the positive ones. Yeah.
I think
I'm sad.
next-
My questions were easy.
no, the last one was good too. Okay, so this is the last one, by the way, guys. A 53-year-old man with long-standing schizophrenia has failed therapy with both first and second generation antipsychotic agents. He still has significant problems with his mood, delusions, and hallucinations. He had agranulocytosis. Which of the following drugs is he on? Oh, we ended with an easy question. Yeah.
That is true.
Okay, so yeah, this is again.
It's just because of agranulocytosis.
Yeah.
I kind of wanted to emphasize on like guys, whenever you have a very significant or like a very characteristic side effect of a drug, just know it because it's definitely coming in the exam. So like in here, granulocytosis, and then for amantadine, the libido reticularis, and I'm pretty sure for a lot of other drugs there's very like characteristic side effects that will definitely come in the exam. And I think.
Do you guys have any questions? Yeah, we're done. If you guys do, like, feel free to ask us at any time. Like, we don't mind.
Thank you guys for attending.
No, thank you.
And yeah, if you have any questions regarding any of this, just contact us on our WhatsApp or email. I'm gonna tweet about how fun this was. Oh,
guys! That's so cute. Okay.
Tomorrow you guys have to attend the psych. It's gonna be Iman and Ibrahim.
Oh yeah. Questions.
I think they're gonna grill you. Like, yeah. That's what I think. Because Ibrahim was preparing from Ambas, so.
Yeah, I don't think we used Ambos. For pharma, usually, like, I never used Ambos.
Yeah,
but,
me too.
Yeah.
Why? Because I don't know, Ibrahim likes to use Ambos.
They like Ambos more, yeah. Plus, psych questions you can get good like psych questions from there.
Yeah, it is true because also Dr. Ali's psych questions are kind of.
Oh yeah, they are
similar, you know. Yeah. Anyways, guys, if you have any questions regarding pharma, regarding neuro in general, if you need any help, just either text us or email us. We're gonna be there, inshallah, to help you. And thank you, guys.
Thank you. And Ramadan Mubarak to all of you.
Yeah. That's